It's never a good idea to try and catch an infection because there's just no guarantee that you will develop a mild illness. Therefore, you are taking a risk. We know that those who have pre existing conditions are at a higher risk of experiencing severe illness and are more likely to be hospitalized, while those who are unvaccinated are at risk for dying. In addition to this, if you do survive the acute infection, you are still at risk of long COVID. And that includes a number of symptoms from fatigue to memory issues and just a general difficulty in going back to normal daily living. And that's really what we want to avoid is unvaccinated individuals experiencing chronic conditions or dying as a result of trying to catch an infection. Vaccines remain to be the safest method of developing immunity or protection against COVID-19. It is also the best way to develop durable, long lasting immunity against this virus. My advice is for those who have chosen to be vaccinated and boosted to encourage them to talk to others and share their experience as to how and why they have made that choice. For those who remain unvaccinated, I would like them to either reach out to a provider or a trusted leader in the community to make sure that they are basing their decision on reliable information because it is a true life or death situation. We also now have data to show that vaccination not only protects the individual, it also protects others around them. And these will be your family and friends. And that's why we should choose to be vaccinated. We need to do this for them. We need to do this for our communities. And we need to do it for our frontline healthcare workers who have remained resilient and have provided quality care for our sick patients throughout this pandemic. It is important to note that there may still be a factor of underreporting of cases given the challenges that we continue to face around testing. There are also those individuals who may be experiencing mild to no symptoms and are not being tested. The point in all this is that we need to remain vigilant and not relax too soon, assuming that we are moving past the surge. We have observed that Omicron surges can last somewhere between 3 to 5 weeks after it has become the predominantly circulating variant of concern in the communities from other states. Given that Omicron became the predominantly circulating variant in our community a little bit later, we can anticipate that we'll see at least a couple more weeks of plateau before we see a further decline in our hospitalizations. I would also like to remind folks that our behavior does have the potential to influence how we move past this surge. And that's really the challenge. When you have at-risk behavior and have people not wearing their masks during travel or large gatherings, those can really continue to fuel additional spikes. Variants emerge as a result of viral replication. And the way to think about it is that the higher the burden of virus in the community, the more chances you give the virus to replicate and for mutations to occur. If you stop the spread of infections, then you reduce the chances of variants from emerging in our communities. And the first step to really reduce the transmissions is to be vaccinated. And if you are eligible for a booster, then you should schedule that now. We should also continue to follow mitigation strategies such as wearing our masks, physically distancing, and washing our hands. COVID-19 is a preventable disease. And if we follow this mitigation strategies, then we can reduce the spread of the virus, and that would help curb this pandemic. To me, an endemic state is really when we achieve a sense of stability where we're not at risk of overwhelming our healthcare system and potentially compromising access to healthcare for individuals who have chronic conditions that is other than COVID-19.